What we've done with the Frail Elderly Pathway is we've identified those people over 75 who either have been in hospital or are at risk in the community of either admission or are just vulnerable in their own homes.
Hello. Hello.
Part of the Frail Elderly Pathway is really the connection that we've got across social work, pharmacists in the community and consultant geriatricians with district nurses and GPs. And their role really is that they're available to support the key worker in terms of supporting the patient.
Yes, all in all, it feels as though we're working more together than we have previously. We have monthly multidisciplinary team meetings with GPs, community nurses and social workers.
We discuss any risks that have been highlighted recently and whether we need to be making any more interventions. I also meet once a week with the GP where we discuss new patients that have been recently discharged from hospital.
What's special about it is that it gives you an opportunity that we didn't previously have to have that face-to-face contact with GPs and professionals. It's often the little things that make all the difference to the patient's welfare.
We can now give very detailed information, not just about a patient's medical problems, but all their social problems and their functional status when patients are discharged from hospital. We now have a form that can be filled in, giving all the necessary detail, and then that information is then sent out to the local district nursing teams.
It has stopped people being readmitted to hospital, which is a big thing, and families that I've been involved with have also feel supported and helped by this.
The patients are included more in the decisions about their care and the care that we are delivering to keep them at home and to prevent these readmissions to hospital.
Gives you confidence to know what's happening.
Do you manage that okay? Patients have greater understanding of the medication when I've been out to see them. They appreciate why they need to take something. There's also a greater understanding of ordering the medication so they don't have as much stockpiling.
You know, somebody coming in to talk to you is very, very helpful. And particularly with the pharmacist who showed me how to use various bits of the equipment that I use.
One of the real benefits that we're seeing coming through quite strongly is increased patient satisfaction, and I think that's moved from around 62% satisfied to about 85% at the moment.
There's also real evidence that the most frail and vulnerable patients, for example those who are in care home settings, have had really good and robust forward care planning when they come into hospital.
Now with the Frail Elderly Pathway, it enables us to plan care in a more holistic, structured and proactive way.
I think it means that the patients has seamless service. It improves communication links between the multidisciplinary team and the patients are going to benefit from that.
Rather than firefighting, we're actually working in a much more preventative way, which is benefiting patients across the board.